Today's webinar is titled Why We Have Homelessness and What to Do About It. It is part of our quarterly Housing, Equity, and Community Series, HEC, that we organize in partnership with our friends at the UCLA Ziman Center for Real Estate. I'll be moderating our panel today. I'm Shane Phillips. I manage the housing initiative within the Lewis Center for Regional Policy Studies. And our three speakers will be sharing a short presentation, each of them, which will be followed by some questions from me and an opportunity to take some questions from the audience. Our speakers in order of appearance are Gregg Colburn, Assistant Professor of Real Estate at the University of Washington and author of the book, Homelessness is a Housing Problem. Deyanira Nevárez Martínez, Assistant Professor in the Urban and Regional Planning Program at Michigan State, and Rysman, Chief Programs Officer at the Los Angeles Homeless Services Authority, also known as LAHSA. Gregg, Dea, and Molly, you are welcome to provide a bit more introduction to your background and your work in your presentations, but I just want to thank you for being here today, and also at the UCLA Arrowhead Symposium we had back in October. Just so our listeners know, this is actually a repeat of one of our sessions from that Arrowhead Symposium, and people loved it so much that we wanted to bring it to a broader audience, and we're excited to have all three of you back with us here today. I just want to acknowledge the Gabrielino and Tongva peoples as the traditional land caretakers of Tavangard. As a land grant institution, we at UCLA pay our respects to the ancestors, elders, and relatives or relations past, present, and emerging. So today we are talking about homelessness, and we're tackling it with a very wide scope, from the conditions that put people at greater risk of homelessness to the actual street-level experience of homelessness, and the ongoing efforts to provide services, get people housed, and prevent people from becoming homeless in the first place. Homelessness is the top concern for LA County residents, with 95% describing it as a serious or very serious problem in a survey from a few years ago, and I feel pretty confident saying that those concerns haven't died down since that time. But even if we can all agree that it is a major problem, we don't all agree on why it's a problem, what's causing it, or what to do about it. Homelessness, from my perspective, is a problem first and foremost for the people experiencing it, and it is a reflection of something very broken in our society, that it's as common as it is, and that so many people experiencing homelessness or experience homelessness for so long without relief. But among those of us who are more securely housed, there are more and less selfish reasons that people see it as a problem. And I want to come back to that in our conversation here today, because the conditions and persistence of homelessness in places like Los Angeles clearly influence how people respond and the policies, programs, and interventions that they're willing to support. Put another way, we shouldn't always automatically dismiss views about homelessness that we may disagree with, or might in some cases even find repugnant, because I think the last few years have demonstrated that people's views aren't static on this, and that there may be opportunities to change minds. As to what's causing homelessness, there are all sorts of notions, some valid and others not so much, but all of our speakers today have insights into that question, and so I'm going to save discussion of causes for them. And when we get to solutions, I think we all are aware that there is no silver bullet here. Prevention is key, making sure as few people as possible live with housing instability or lose access to housing. And prevention takes different forms, requiring targeted support for vulnerable households for sure, but it also requires reimagining a housing market and creating that housing market, changing it from what it has been defined by for so long, which is this system of scarcity. We also need strategies and resources to help newly unhoused people back into stable housing as quickly as possible, and those strategies will often be very different from what's needed to assist people who have been unhoused for much longer, or who have experienced homelessness on multiple occasions, what we would call chronically homeless. All of this is to say that homelessness is complicated, and like all housing and urban policy, it's influenced by a combination of economics, politics, systemic racism, social policy, media and communications, and more that I'm sure we're going to cover here in the next 80 minutes or so. We're not going to cover everything today, and we're certainly not going to provide or have all the answers, but we do want to establish a strong foundation of knowledge for those who may not have much background in this space, and also introduce everyone here, regardless of your background or experience, to some new insights and ways of thinking about and talking about homelessness. Our goal is to, again, take a really broad perspective here from the risk factors that put people at greater risk to the ways we intervene when someone has lost their home and finds themselves couch surfing, living in a shelter, or living in a street, on the street or in a vehicle. One final thing I want to note before I pass things on to our speakers is our podcast, UCLA Housing Voice, which I try to take every opportunity to mention to new audiences. Every episode is a sort of deep dive into emerging housing research, and we produce it so that you don't need a PhD to understand it, and not talking down to anyone because I don't have a PhD myself, so I want to create something that makes sense to me as well. We have one episode in particular with Beth Shin of Vanderbilt University that's about the effectiveness of different homelessness solutions, and I think it's a really great complement to this conversation today for anyone interested. Hopefully someone can share that in the Q&A or in the chat, a link to that episode. So let me hand it off to our first speaker. Gregg, are you here? Gregg, welcome. I see you're just getting set up there.
My sincere apologies. Not the best tech day for me. I apologize.
It happens to all of us. We were about to have Diego first, but you showed up in the nick of time.
Great.
I think this makes more sense having you go first. And so I think you saw kind of my scripted intro. You know what I had to say, but I'll just say it really quickly here. You're really focused on these risk factors that contribute to or increase the odds that someone will become homeless or the likelihood they'll become homeless. But also, you discuss many of the things that people assume are causes of homelessness, and maybe understandably, but that aren't very well supported by the evidence. So let me turn it over to you to talk about these risk factors and what is actually contributing to or not contributing to these elevated rates of homelessness in certain places.
Again, apologies, everyone. I'll get started here. Thanks so much for having me. I'm really excited to have a chance to present my research in partnership with the other panelists here and with Shane and the good folks at UCLA. My presentation is going to be a brief summary of the book that my colleague Clayton Aldern and I published back in 2022, about a year ago just now, called Homelessness is a Housing Problem. And the motivation for this book was really to identify an explanation for why some communities in the United States have really high rates of homelessness while others don't. And I'm up here in Seattle, and as you may be aware, we've got a pretty significant problem with homelessness up here. And my observation as I was in community meetings is that we just didn't really understand what was driving this. And as a result, our response, our policy response, our community's response may not have been as effective as we otherwise would have liked it to be. Next slide, please. So one of the challenges when we start to talk about causes of homelessness is we have a unit of analysis issue, which is, are we thinking about this at the individual level or at the community level? And as it turns out, the answers to the question of what causes homelessness are different depending on the specific unit of analysis. So when we do our annual point in time count, which was just conducted across the nation at the end of January last month, we ask people, we also do surveys, we ask people, why are you homeless? And we get responses like this all over the map. Domestic violence, I got in an argument with my roommate, I lost my job, housing was too expensive, I drink too much, whatever the case may be. And then these get published and people talk about them, and when we call them causes of homelessness. Next slide, please. One of the challenges I think we have is when we use that type of information, it's not to suggest that those aren't real factors. Absolutely, domestic violence can cause homelessness in a particular circumstance. But the point that we try to draw a distinction of in the book is a difference between a root cause and a precipitating event. In this case, many of those things I would call precipitating events, right? In the wrong set of circumstances, divorce can lead to homelessness. But for many people who get divorced, they never experience homelessness, either because of their personal circumstances or where they happen to be residing. And so what we're trying to do in the book is to identify at a community level what are the root causes, root drivers of homelessness. And rather than focusing on precipitating events, really zeroing in our effort and attention on these root causes. Next slide, please. And so the way that I like to highlight the difference between these two factors is the game of musical chairs. And so if you imagine a game with 10 friends, 10 chairs, one chair is taken away, and when the music stops, people scramble for a chair, and Mike loses. Mike was on crutches. And if we interview Mike or other competitors and say, why do you think Mike lost? He'd say, well, I had a bad ankle. Which is true within the when you have a game with only 9 chairs and 10 people, someone by definition will lose. And Mike, who was vulnerable after hurting his ankle, was the person most likely to lose. And so in that case, yes, it's true that that was a cause of his chairlessness. But if we really think critically, obviously the cause of the chairlessness was the fact that we didn't have 10 chairs. And I think this scarcity that we have in many of our coastal cities, housing scarcity, really creates this game of musical chairs for housing, and that it shouldn't surprise us that people who are poor or have behavioral health issues or have been subject to systematic discrimination end up losing the game of musical chairs, or in this case, the game of securing housing in an expensive, competitive environment. Next slide, please. So the fundamental question that we try to seek to answer in this book is, why does Seattle or LA or San Francisco or New York or Boston, DC have 5 times the per capita rate of homelessness, right? What explains regional variation throughout the United States? And one of the key points here, does LA, for example, have a large population of homelessness because it has people with these individual vulnerabilities, right? Drug use, mental illness, poverty. The literature demonstrates here very clearly that poverty, mental illness, and drug use are individual risk factors. We're not disputing that in any way, but the context in which that happens really matters. So the question for LA would be, does LA have a big homeless population because it has more people with these individual risk factors? The answer to that question is no, right? The context in which those vulnerabilities happen is far more important. Next slide, please. So this is a book about cities, not about people, and it doesn't mean that person-focused research isn't important. It absolutely is. It absolutely is. But the question here is, what explains regional variation? And the punchline is, the thesis of our book is that tight housing markets accentuate vulnerabilities. Okay? And these vulnerabilities then serve as a sorting mechanism. They identify the people who are most likely to experience homelessness in a place where housing is scarce. And that's what we observe on the streets in Los Angeles and San Francisco and Seattle every day, right? That these vulnerabilities sort people into the experience of homelessness because housing is so difficult to procure. Next slide, please. And so what we do to try to answer this question, I'm going to do this quickly and so we can hand it off to the other panelists here, is to think about what the potential explanations are. Next slide, please. Just to orient you, and I won't spend time on this, but there's about a 5-to-1 relationship between high and low per capita jurisdictions in terms of rates of homelessness, which is a really big variation. We're not talking 20 or 30% more, it's 5 times, right? So that's the variation we're interested in here. Next slide, please. And so the first category of explanations we pursue are individual in nature. Next slide. Obviously, poverty causes homelessness. There's no doubt about this. This is a slide of poverty at the community, city, or county level, depending on how cities count their homelessness. The relationship to homelessness. And what's interesting is there's some relationship here, but it's in the opposite direction of what we would expect. Where rates of poverty are higher, rates of homelessness tend to be lower, which is a bit of a head scratcher. Right? Homelessness thrives amidst affluence far more so than it does amidst poverty. Detroit, for example, very impoverished city with far lower rates of homelessness than affluent cities like San Francisco. Next slide, please. This is mental illness. The point of this slide is that there's mental illness in every state in the country. It doesn't have any statistical relationship whatsoever to rates of homelessness. So California, Washington doesn't have more homelessness because we have more, disproportionately more people experiencing mental illness. That's not the case. The same is true with drug abuse. The slide looks very similar. Next slide. That's the illicit drug use. Next slide. And then this is in race. We can't talk about homelessness without thinking about race. Black, brown, indigenous households are 3 to 4 times overrepresented in the homeless population relative to their share of the general public. But what's interesting here is that, and I want to be very clear about this, race doesn't cause homelessness. Racism causes homelessness. Right? So the mere presence of more Black, brown, indigenous people in a community doesn't produce higher rates of homelessness, right? Race interacts with racist and discriminatory systems to produce disproportionate rates of homelessness. And that's true across the country. So race doesn't explain regional variation. Black, brown, indigenous people are overrepresented in Seattle. They're also overrepresented in Chicago. Next slide, please. So the local context is the second category that we think about. What is it about LA, San Francisco, Seattle that's producing disproportionate rates of homelessness? Next slide. Weather is a convenient explanation. Obviously in LA, I'm sure you hear this all the time, LA is an accommodating, moderate climate, and therefore, of course, people want to be homeless there. But when you actually plot this, what you'll see is there really isn't a strong relationship between weather and homelessness. There are cold places, New York and Boston, with high rates of homelessness, and there are plenty of warm places, Miami, Phoenix, Dallas, that have far lower rates of homelessness than our coastal cities. So It certainly has an impact on your policy response, shelter versus not shelter, and that's a conversation, a longer conversation. But in terms of overall rates of homelessness, weather doesn't explain variation. Next slide, please. This is looking at generosity of welfare benefits. And given the time, I'm not going to go into all the details on this. But the point of this slide is that there's variation in the primary federal welfare program called TANF from state to state. And so we can actually use that variation to see if it explains homelessness in any way. And what we see is it doesn't. Right, so we don't see people moving to more generous locations to take advantage of benefits that are more generous than in stingy places. But this narrative is really prevalent, but the data don't really support that argument at all about this magnet effect of generous benefits. Next slide. This is also looking at that migration story. Do we see disproportionate migration of low-income households to places with high rates of homelessness to produce these disproportionately high rates? We don't. In fact, the low-income migration rate into communities like Seattle and San Francisco is actually quite low compared to other jurisdictions. So again, we can't really blame this mobility argument. Generally speaking, homelessness is a homegrown problem. It's a community created problem. People experiencing homelessness in your community are largely from your community. Next slide, please. And then finally, we look at housing market explanations. Would this potentially help us explain regional variation? Next slide. And what we see is that where rents are high, homelessness is high. Okay. And this is a relationship that has been known for a long time in the academy, but really hasn't filtered out into the general public, which is one of the reasons why I wanted to write this book. Okay, next slide. A related variable is vacancy rates. When vacancy rates are low, meaning housing is not very accessible, we see higher rates of homelessness. And so when you put those two things together, what you get is a climate that is accommodating for homelessness, right? If you have very expensive housing that's not very available, you're going to have higher rates of homelessness. And the statistics are pretty compelling on that. It's hard to find a counter case among big cities in the United States. Next slide, please. And next slide. So to try to make some sense of all of this, what we try to do is explain why is it that certain places have high rents and low vacancies? Because if that's a key important factor, understanding why that exists is important. On the demand side for housing, high population growth is clearly a demand factor for housing. And so what you'll see in our coastal cities is they have had high demand for housing. Lots of people moving there, robust job markets, robust economies, and that certainly puts pressure on the housing market. The other thing that's really important, though, is what is the housing response? When you get a lot of people moving to your community, do you build lots of housing or do you not build much housing? And what we find is that many of our coastal cities have relatively inelastic housing markets, meaning when prices go up, we don't build enough housing. And the drivers of elasticity are topography. If you have mountains and water, that constrains your ability to construct housing. And the regulatory environment can be more accommodating or less accommodating, depending on your jurisdiction. So San Francisco is a prime example of challenging topography and very restrictive regulations. It's hard to build in San Francisco. And so when you put a demand shock in partnership with very inelastic housing supply, what you end up with is a housing crisis. Next slide, please. So what this tries to do, this graph is show both the demand and supply for housing. The x-axis, the bottom axis is the change in population, which is a proxy for housing demand. And then the y-axis is housing supply elasticity. So the bottom right corner is really the perfect storm for housing crisis. We've got robust population growth and relatively inelastic housing supply. Numbers below 1 would be considered inelastic. And what's interesting is that upper right quadrant, that bubble, is the Sun Belt of places that grew very rapidly, but they've had very robust supply response. And as a result, their vacancy rates, which are the numbers in parentheses there, have stayed more elevated. And they've been able to stave off a housing crisis. I would say Austin is the one city in that upper right bubble that's starting to drift down. They're starting to not keep up with the demand, and they're starting to see more of this housing crisis and homelessness issues that we see on the coast. And so that's an important city for us to follow as we think about the middle of the country and hoping that the homelessness problems on our coast don't creep into some of those dynamic, fast-growing cities in the middle of the country. Next slide. Next slide. So when people say, okay, fine, Greg, I may buy your argument here that that this is a housing issue. What do we need to do? To date, we've spent a lot of money on homelessness, but for the most part, these are really, really important investments. But they have largely been a response to the homelessness crisis. They are not intervening upstream as capital investments to construct housing would. And so ultimately what we need is a much greater commitment to the construction or subsidy to ensure that people with lower incomes can access housing. And right now that has been, while we've made some investments, they have not been sufficient to the scale of the problem. And so ultimately, and part of that story is not only investments on housing, but also to ensure that our land use is supportive of greater density, which is essential in our cities. Next slide, please. Next slide. And so to wrap up here, I'm at the end of my time. What I want to stress here, and one of the important things about this book is that I believe that continuing to diagnose homelessness as an issue of the individual, of personal failings, will undermine our efforts to prevent and end homelessness. We need to think about this as a structural issue. This is a structural problem that requires a structural response. And structural responses mean, equity in society, racial equity, economic equity, and a housing market response that ensures that people can find housing. And I like to leave on an optimistic point. People say, that's great, Greg, but how do we know that housing is going to work? It's because we've done this. We cut veteran homelessness in the United States in half over 10 years. And how did we do that? We provided them housing. In some cases, that was providing a housing unit to someone. In some cases, it was a unit plus services. In other cases, it was a voucher. But we know that these interventions work. The question then is, will we extend them to a broader population who desperately need housing in our communities? Thanks so much, and I'll hand it back to you, Shane.
Great. Thank you, Greg. And we definitely want to come back to that example of veteran homelessness type of question later on about sort of bright spots, good examples that we can actually learn from. But I want to have a follow-up here really quickly. You definitely addressed this in your presentation, but, I feel like one of the most common responses I see to arguments like yours or to your argument itself is something along the lines of, you can say all you want about high rents and low housing vacancies as the major drivers of homelessness, but I can see in my neighborhood every day on my street that unhoused people have severe mental illnesses or drug addiction or what have you. And so how can you deny the importance of these things in the homelessness crisis? I think that response requires a somewhat willful misreading of your work and your messaging, but it does seem to come up often enough. And I think there's something there that there's a distinction between different kinds of support that are needed and people experiencing different problems. I'm just curious to hear you say a little bit more about how you respond when this kind of critique comes up.
Sure. Yeah, I do. And thank you, Shane. I hear that a lot. And I understand it is a bit of an analytical leap to go from the person that you see on the street who's in severe distress by saying, well, if we just had housing units, this would be fine. And so I think it's a fair question. So a couple ways to answer that is that there are also people using drugs in other communities that don't end up homeless, right? And that I always think about West Virginia, the home of the opioid epidemic. It is a crisis, right? An absolute crisis, but they don't have a problem with homelessness there. I'm not to minimize that opioid epidemic, but the point is that people are finding housing. And so the context in which that drug use, that mental illness happens, really, really matters. And the other thing that I think is really important is that when people don't have housing, whatever issues they have are magnified, right? It is like throwing match on rags with gasoline on them. So if someone has minor issues with mental illness, they lose their job, and you leave them on the street for a year, that mental illness is going to be a heck of a lot worse, right? And so by not housing people, we are magnifying our behavioral health crisis in major, major ways. And so, yes, there are going to be some people who have severe mental illness who need treatment. Some people say, well, Greg, you're anti-treatment. I'm not anti-treatment. I am pro-treatment. But I also believe that we could treat every person in Seattle right now. If I could wave a magic wand and end all addiction, we would still have a problem with homelessness because housing is scarce, it's expensive, and there are enough people who can't access that. And so it is a both and. There's no question here. I'm not creating a dichotomy here. It comes together. Housing is necessary to make sure that this doesn't continue, and treatment for people who need it is absolutely necessary.
Got it. Thank you. Yeah, and I think it's very intuitive to just think about this in terms of like, if something goes wrong in your life, if you lose your job, if you get divorced, if, you know, an addiction kind of returns and you kind of fall off the wagon, the odds that that leads to homelessness are probably going to be much, much higher if the cheapest home you can find on the market is $1,500 instead of $400 as it is in some places. So I think that's, you know, just a really important point to emphasize. Okay, so I kind of gave an introduction to Dea a little bit already, Deyanira, Nevárez, Martínez from Michigan State. So I think I don't have to say a lot more, but we've transitioned from talking to risk factors, but, you know, now we have people who are actually living unhoused, on the street, in vehicles. What are we doing about it? What are we doing wrong?
Yes, let me go ahead and share my screen. Can you all see it? Yeah, there you go. All right. Well, thank you very much for that introduction, Shane. I'm really glad that Gregg got here in time so we could do it in this order, because I think it's really informative to kind of do it in the order that we have it. Hi, everyone. First, I really want to thank all of you for being here today, and I also want to thank the organizers for making space to address such important issues and to facilitate such important conversations. My name is Deyanira Nevárez Martínez, and I'm an assistant professor of urban and regional planning at Michigan State University. Today, so my work in general focuses on the role of the state in informal housing. I am currently working on some issues in LA around Latinx homelessness and doubled up homelessness, but today I will be presenting to you findings from an ethnographic research project that I completed in Orange County in 2020 with unhoused folks. And I will be focusing on street-level interactions between street-level bureaucrats and unhoused individuals. Specifically, I will touch upon the unhoused experience and how they experience these interactions as they attempt to navigate the homelessness services bureaucracy. And just a brief note before we start, because I use the term street-level bureaucrats and street-level bureaucracy quite a bit. In this context of homelessness services, I mean street-facing public service employees such as social workers, police officers, code enforcement officers, and increasingly nonprofit workers who perform their work with government contracts. So first, I'll give a little bit of information about Orange County homelessness. Many more folks are familiar with the issue in Los Angeles and San Francisco, but not many know what is going on in Orange County, even though it's so close to most of you in LA. And as you can see, in 2019, 2,899 individuals were considered sheltered homeless, while 3,961 were unsheltered. In 2020 and 2021, only counts for sheltered homelessness were recorded because of the COVID pandemic, and those numbers were 3,017 and 2,441 respectively. In 2022, the count included both sheltered and unsheltered homeless, and the numbers were officially recorded as 2,661 for sheltered and 3,057 for unsheltered. So as you're looking at these numbers, you're probably noticing a decrease, and the county has been very forthcoming about touting the decrease as a big win. However, the decrease in unhoused residents from 2019 to 2022, which is about 1,142, is very close to the 947 unhoused people that died during the same time period in Orange County. And obviously, we cannot say that these folks are the same people. However, I think that we need to have a conversation and we need to talk about the trend and what the closeness of these numbers mean as people cycle in and out of homelessness. But now I have a little bit of context, and I'll introduce you to the city in which I completed my field work, which took place over 10 months between February and December of 2020. I should add here that Beach City is, of course, a pseudonym meant to mask the city that I conducted my research in. and all of the names I use in this presentation are pseudonyms. This is common practice in ethnographic research and is meant to protect my informants, who were city, county, and nonprofit employees working on homelessness issues in this city, as well as unhoused residents that use the city services often. Beach City is a very typical coastal community in Orange County. It has a population of less than 100,000 and the median value of owner-occupied housing units of over $930,000. The rents are high, and it has the third largest homeless population of all coastal cities in the county. So the primary methods that I used to collect my data were in-depth, semi-structured interviews. I conducted 60 of them. Also archival research, document analysis, and over 200 hours of participant observation of interactions between street-level bureaucrats and unhoused folks, but also both of these actors and the community at large. During my time in the field, I was present during arrests, searches, one of which happened right in the middle of one of my interviews, medical visits, outreach contacts, and many other everyday interactions. I observed harassment of unhoused people and experienced it myself for interacting with them. I interviewed 29 street-level bureaucrats. These were a combination of what I call traditional street-level bureaucrats, which include city, county, and state employees, and also what I call new street-level bureaucrats, who were nonprofit workers. In addition, I also spoke to 31 individuals experiencing homelessness in Beach City about their interactions with these frontline workers. The majority of the data that follows comes from these interviews. Here we go. So now that I've given you a bit of a sense of the amount of data that was collected for this project, you can probably surmise that this presentation could be a 2-hour talk within itself, but being mindful of all of our time, I will highlight only 2 vignettes that I feel best illustrate the 2 main findings that I want to highlight. In my published work, which I'm happy to share, I highlight more. These 2 vignettes will illustrate two very different outcomes, one more positive than the other, but both with very important lessons. So first, we will meet Spencer, a 73-year-old man who had been on the street in Beach City for decades. The first time I met Spencer, he was in his usual spot outside the Beach City Senior Center. I was there for a meeting, and he helped me to find the door. From that day on, I would come to expect to see Spencer by the Senior Center. Like Jacob at the beach or Jimmy in the alley, he had found the spot where he was comfortable and where he wanted to be. On one of the days, I was out with Felice, who is a dedicated volunteer in Beach City. We met up with Kendra at a fast food restaurant. Kendra works for a small nonprofit and helps individuals with many services. She started to tell Felice and myself that she had been working with Spencer because his health was severely deteriorating. His dementia was really getting in the way, and he really needed to get indoors soon. She was optimistic because she had been in contact with Spencer's sister, and she was hopeful that they would soon be able to get him into a safe place. One morning, a few weeks later, Bertha, the director of the Senior Center, found Spencer dead outside the building. So what happened to Spencer between the time that he had been on a path to shelter and when he passed away? Well, he broke his pelvis and was taken to the hospital. He was in the hospital for several days recovering and was released to a rehabilitative care facility close to Beach City. He then was allowed to check himself out of the facility, even though he suffered from worsening and deteriorating dementia. When his sister called the facility to check on him, and she learned he had been allowed to leave, she contacted Kendra to go check on him. Sure enough, Spencer was at the Senior Center. But Kendra wasn't able to find a place for him to go because there is no shelter in Beach City or any of its surrounding cities. So even though Spencer was not well physically or mentally, there was nowhere for him to go. The truly sad part about Spencer's story is that he and his family were doing everything possible to get him housed. Even though his sister did not live in Beach City anymore, she was in contact with local nonprofits and the city trying to navigate the bureaucracy. They had a plan, and she had convinced Spencer to go along with this plan. Spencer and his family were actively working on accessing housing and medical care for him. Spencer had even been part of a lawsuit against the city, where he explained that if there were an indoor shelter with services, I would be very excited to try staying there and hope for help getting into housing I could afford based on my limited income. But as far as I know, there is no shelter in Beach City that will take me and no housing that I can afford on my limited income. Spencer lived on his Social Security check and could only afford a hotel room a couple of nights a month. And now we will meet Teresa. Teresa is a local unhoused Beach City resident that is an elderly and disabled widow who lost her RV when local law enforcement impounded it, and she was unable to get it out because she did not have adequate identification. Teresa has developed a friendship with Janet, a local woman who is very active in the local Catholic Church and cares about trying to help those experiencing homelessness. Janet has done a lot to try and help Teresa over the last few years, and when the COVID-19 pandemic started, she was very concerned because Teresa is in several high-risk categories. For several weeks, Janet took some of her personal money and fundraised from individuals in her church and other personal friends to put Teresa up in a hotel. However, this approach proved unsustainable very quickly. Janet and Felice decided to try and get Teresa into Project Roomkey, which was specifically designed to get people like Teresa into hotels during the pandemic. There was only one small problem. There was no Roomkey hotel in Beach City. The closest Roomkey accommodations were a couple of cities away, and Teresa was unwilling to go. Teresa, like many in her situation, has grown to love Beach City in the many years that she's lived there and finds the idea of being displaced very emotionally distressing. She has a community of friends and supporters and does not want to go to a place where she will not have any of these things. Janet and Felice, with the help of other local advocates, were able to somehow convince one of the organizations that managed Roomkey resources in Orange County to allow Teresa to get into a local Beach City hotel, and they paid for it with Roomkey money. This was a really big win. However, they were unable to replicate it as other Beach City residents got turned down for similar arrangements. Janet and Felice, who would like to help other local individuals experiencing homelessness to make similar arrangements, felt like they could not push too hard because they risked putting Teresa's funding in jeopardy if they made a big fuss. So, why did I share these stories? Well, based on these and other interactions, I found what I call performative productivity and arbitrariness to be important factors affecting the outcomes of individuals. In this study, what I call performative productivity is a well-choreographed dance of getting individuals screened using the Vulnerability Index Service Prioritization Decision Assistance Tool, or the VI-SPDAT, an assessment tool used to measure the health and social vulnerabilities and housing needs of homeless individuals, getting a vulnerability score, entering them into the coordinated entry system and the homelessness management information system, then setting up meetings, filling out countless forms that require invasive sharing of information, signing up for wait lists, and sometimes surrendering the rights and often accepting an externally imposed moralistic and often religious framework that requires sobriety and or employment. If a person wants any services at all, the terms are non-negotiable, thus compelling the homeless to participate in the performance required or risk the eligibility of any non-housing services that they have been able to attain, as minuscule or limited as these may be. This may not be a problem if it resulted in real change for those experiencing homelessness. However, as it stands, at the end of the process, most go off to sleep on the street once again. This was especially evident in Spencer's case, where there was a very clear mismatch between willingness to participate in this process from everyone involved, including the unhoused person, their family, and even the nonprofit workers, but being unable to actually connect with tangible services that could get Spencer indoors. At the end of his process, Spencer went back to sleep on the street and never woke up. And secondly, I found arbitrariness to be playing a role. Even though Teresa is an incredibly nice and deserving woman, there was no clearly apparent reason why she was able to be in a hotel in Beach City under Project Roomkey when nobody else has qualified for that. Teresa got lucky that Janet and Felice were able to find someone with the authority to say yes on the phone on a day that they happened to be amenable to this. Their inability to replicate this success showcases how discretion can lead to disparate outcomes. Arbitrariness comes about when some individuals who are similarly positioned as others have different outcomes. So while homelessness is a structural issue that affects millions of people and inflicts systemic violence at the aggregate, at the individual level, there is a degree of arbitrariness that creates outcomes for some that initially appear almost inconsistent with the overall system. Those at the street level have a big impact on the lives of the homeless. In many instances, they have the flexibility to make decisions that can greatly change an individual's life, such as in Teresa's case. In Teresa's case, it had a profoundly positive impact on her life. She experienced more security during a time when the entire community has felt very unsafe. This arbitrariness, however, while positive for her, creates mistrust in the system from those that attempt to engage and cannot replicate a positive outcome without any real sense of why the different outcomes occur. To be sure, I think one of the big lessons of this particular component of the research is that understanding that programs, especially as currently delivered, will not solve our homelessness crisis, especially if it is not complementary to and does not lead to permanent long-term housing. I am in general agreement with most of what has been said up to this point. We absolutely have to build more housing, but as a society, we need to understand that there will be a subset of the population that will be unable to pay anything for that housing. As it stands, we are making these individuals work by making them participate in this performance and tag them as service resistant when they decide that they will no longer participate because it does not lead to long-term housing. Thank you.
Thank you, Dea. I wanted to do a follow-up here as well, and it's going to be a little different than the one that I planned, but I think just based on what I heard here, thinking about the performative productivity and the arbitrariness, it was making me think of, and the whole time you were talking was making me think of, here in Los Angeles County, for example, we're investing so many resources, both in supportive housing and shelters, but also services. But the shelters and housing take a long time, and it feels like we're, whereas we can hire social workers and provide services quite a bit faster. And so we end up kind of putting people out on the street trying to provide assistance, but the sort of end stage of that assistance of actually getting people, at least into shelter for some time and then ultimately into long-term housing, it's just not there. And so people are just kind of shuffling things around and trying to, get through this really complicated process. So I'm curious if you could just say a little more about the connection between those things and that the lack of a place for people to go at the end of that process.
Yeah, so there's a little bit of a mismatch, right? Because if what we're trying to do is solve homelessness, the only thing that solves homelessness is housing. Programs and other types of assistance are severely needed and definitely help, but they don't solve homelessness, right? Like that's not what's getting people indoors. And so, yes, housing takes a little bit longer to come to fruition, but there's kind of like a perception that putting the money into these programs and into, getting people into this performative productivity dance of this choreography of getting all these things done is going to help us get there, but it's not at this point. And so that's the problem. I think that we need the programs, we need all of this assistance that's getting to folks, but the first step is really getting them indoors, and then we can go from there, right? And that's not happening. Those things aren't kind of coming together.
Great, thank you. Okay, for our last speaker, our last guest, Molly Rysman We just talked about programs. You are the Chief Programs Officer at LASA. You have a few slides that are going to, I think, help further ground this conversation in our local experience here in LA, where you've worked for a long time, and also kind of zoom out and ask some bigger questions about the relationship of homelessness to housing justice and racial justice. So let me turn it over to you next.
Thank you, Shane, and thank you, Dea and Gregg. It's great to be presenting with both of you again. Let me share my screen. So again, Molly Rysman, Chief Program Officer at LASA. My pronouns are she, her. Always nice to be with UCLA, even if it's virtual, as I'm a UCLA grad. I am going to ask folks today to extend me some grace and do not think about these remarks as representing my employer, the LA Homeless Services Authority, or LASA. These are my remarks as an individual, just representing myself and my experiences. Also encouraging folks who are in the audience to be mindful of the privilege or disadvantage that comes of your own or another's lived experience. If anyone in the virtual room has lived experience of homelessness, welcome. I am not an expert on homelessness, but I do work every day to build authentic and transformational relationships with people with lived experience of homelessness. And most of the content I'm going to be sharing today is based on those relationships and conversations I've had with people with lived experience. Let me see if I can get us to the next slide. There we go. I've had the extraordinary privilege of working on helping people find home, safety, and community for over 20 years. My first job in the field was actually as a peer advocate in a drop-in center for homeless young people that was run by a nonprofit. And when I think back about that experience and that first job, there are some things about this work that haven't changed in how I view it. And there's other ways that I found that the work is much more complex than what I could have imagined when I first started. What I knew then and still absolutely believe is that authentic transformational relationships can have a profound impact on people that we're trying to assist. But there are thousands of ways that we've structured our society, our culture, our government, our policies, and our programs that make authentic transformational relationships very difficult to build and sustain. That said, LA is an amazing community in which to work on homelessness because there are literally tens of thousands of Angelenos working every day to bring their unhoused neighbors home. And it is those folks doing that amazing foundational work that are my inspiration to keep at it as hard as it is. So I was very glad that we started with the land acknowledgement because I think that was one of those things that I really didn't think about when I had that first job in the field. Depending on where you're logging into this webinar, you're likely on the traditional, ancestral, and unceded territory of either the Gabrielino Tongva Kizh peoples or the Fernandino Tatavan peoples or the Chumash peoples. It is all stolen land. And homelessness is the ultimate result of a very toxic legacy of exclusion that is alive and well today. Land and wealth dispossession are not ancient history. The legacy of slavery is not ancient history. The legal protections that exist for homeowners but do not exist for renters in this country is the manifestation of our laws and policies that represent this legacy. One of the stories I like to share is that one of my early experiences also in the field was on a neighborhood council. And on that neighborhood council, there was a discussion about removing parking on a street that had a lot of apartments. And one of the people said, well, where are the people in the apartments going to park if we remove all the parking on this street? And somebody said, well, the renters aren't real members of this community. The real members of this community are the homeowners. And that is a sentiment that is very alive and well. Not normally said that explicitly, but alive and well. And one of the things we heard at the Arrowhead Symposium that I really liked was Annie Freiman framing our conversation around our current housing system as struggling with the tension of producing housing for social equity versus private gain. We do not produce enough housing because we are protecting private gain for the few, overseeing land as an amenity to serve everyone because our country was really designed to protect the rights of white colonizing landowners and to extract everything, including land and labor, from indigenous, Black, and immigrant communities. Much of the anger around homelessness today is still rooted in ways about who is believed to be allowed in community and who is not allowed in community. So it's very much a part of what we're experiencing as we're trying to do this work. I think what surprises me the most is the sort of popular cognitive dissonance between the reality we see right in front of us and the stories we tell ourselves. We all heard the slogan of "the rent is too damn high." Our housing system is profoundly broken. We have over 10 million renter households in this country paying over half their income in rent, which means we have 10 million households literally teetering on the edge of homelessness. We know that 20% of American households have essentially been left out of the housing market because they'll never be able to pay market rents without subsidies. And despite knowing that these are the economic realities of our country and our housing market, our safety net only assists 1 out of every 4 of those 20% of American households that qualify for housing assistance. So we know 20% of households can't pay for rent, and yet we only assist about a quarter of those. And yet every day you hear people blaming people who are experiencing homelessness for their situation. And we've heard a lot of talk about this morning about people saying what's wrong with people experiencing homelessness. It must be their fault. They must have become homeless because of substance use or mental illness, when all of us who work in the field know that substance use and mental illness are actually caused by homelessness, not the other way around. There are no quick fixes to this. That's the sort of other popular cognitive dissonance that kills me, is that question of like, why haven't we fixed this yet? The voters passed tax measures. Shouldn't the tents be gone? But did we fix our housing system? Did we solve housing discrimination? Did we pay reparations to address the racial wealth gap? Have we stopped rents from rising faster than incomes? Are we building enough affordable housing? Have we stopped NIMBYism from blocking construction of affordable housing? Are we funding solutions to scale? And of course, we're not doing any of those. And yet we wonder why the tents are still out there. So a little bit about what's happening here in Los Angeles. In 2021, our homeless services or rehousing system here in LA County helped make over 21,000 permanent housing placements, meaning that we assisted people experiencing homelessness to now either lease or own their own home, or live with a household member who leases or owns their own home. This does not equal exactly 21,000 people, because about 8.5% of those placements were people who were actually placed twice in a year. They got into permanent housing, fell out, and went back in. But about 19,000 people exited homelessness in calendar year 2021. That's an extraordinary accomplishment, helping 19,000 people off the streets, and that's been a pretty consistent accomplishment. Over the last 4 years, it's been about 19 to 20,000 people a year, every year, meaning that we've gotten close to 80,000 people off the streets in the last 4 years. Also, just, highlighting, we talk a lot about permanent supportive housing. That is one strategy that's used to get folks off the streets, but we actually see even larger number of folks getting off the streets with time-limited subsidies, which is a short-term rental assistance program. And we see that the most common strategy for folks getting off the streets is actually reuniting with family or moving in with family or friends who have an apartment or a home. That said, we've had this accomplishment, but the homeless count in January 2022 found that 69,000 people were experiencing homelessness in the county, including about 20,000 of those people who were in shelters and about 49,000 who were living outside or in vehicles. We actually found the homeless count somewhat positive, because between 2020 and 2022, we only saw homelessness rise 4% in LA. And in the previous period between 2018 and 2020, we saw it increase 26%. So we've credited this flattening of the curve in terms of the increase in homelessness with the extraordinary tenant protections, including eviction moratoriums and financial assistance for back rent provided during the pandemic. Government made some incredible investments and policies during the pandemic that we all need to learn from. We're rehousing an incredible number of people in LA each year, but it won't matter if tens of thousands of people become homeless every year because of housing discrimination, our housing supply shortages, and the lack of protections for renters. So we need to get really honest about what's driving homelessness here in LA and across the country. So I've been part of many, many plans to end homelessness and seen many of those plans not succeed because we have not been willing to be really serious about the true drivers of homelessness. And I couldn't agree with Deya more. I am the Chief Program Officer at LASA, and I am very clear that programs will not end homelessness. People experiencing unsheltered homelessness are definitely suffering, and they need help, and programs do help. Those 19,000 people who were housed last year appreciate every Triple H dollar, every Measure H dollar that got them over a roof over their head, trust me. But we still have tens of thousands of people who will become homeless next year if LA does not address what's not working in our housing market and does not really acknowledge that our housing market is working exactly as designed, in that it's excluding a whole lot of people. We need to frame what we're doing around a housing justice model to try and get to the underlying causes of homelessness. So the graphic on this slide was developed by the Urban Institute's Housing Justice Lab. We have to address these policies, practices, and laws of exclusion if we really want to make a dent on homelessness. If we are not serious about wanting everyone to have a home, we're not really getting at those true causes. The housing shortage is a very serious issue, but we also know it's not the sole cause of homelessness, because if it was, we wouldn't see 30% of people who experience homelessness in LA being Black when they're only 9% of the population. Same thing with the indigenous population. We see 2% of people experiencing homelessness are American Indian, Alaskan Native, when they're only 1% of the general population. We also saw Latino homelessness increase 24% in the last 2 years. So housing supply is a big issue, but we also have to get to those policies around exclusion that are having a much bigger impact on people of color. So I want to talk a little bit what it means to embed housing justice into our solutions. So first, we have to address land and wealth dispossession and the racial wealth gap with reparations. If you're not ready to talk about reparations, you're really not ready to talk seriously about homelessness. We're going to have to re-enfranchise the communities that we took everything away from as the foundation of our efforts to fix our housing system before we can take on broader reforms. If we do not address the racial wealth gap, we are actually likely to exacerbate that racial wealth gap with some of our solutions. Secondly, if you're not ready to build authentic relationships with people with lived experience of homelessness and co-create solutions, then you're also not serious about stopping the legacy of exclusion, which has driven so much of what we see in homelessness. We have to also understand that as long as solutions are not provided as a legal right, thousands of people will be left behind. When I traveled in Europe, I learned that housing benefits, like our country's Section 8 program, are an entitlement, which means that everyone who income qualifies gets rental assistance. In LA, that looks like about 1 in 10 people who income qualify for housing assistance actually get that assistance. And vouchers alone are not the answer. We obviously need to expand supply where those vouchers can be used, but without a legal entitlement or a right to housing, people of color will continue to be disproportionately impacted by homelessness. Our tenant protections are also a joke compared to Europe. The eviction crisis is just as, if not more severe than the housing crisis. And it is not only the result of scarcity. We have a lot of racially motivated policies that are driving the eviction crisis. We need, in addition to addressing our eviction crisis, we need new models of cooperative land stewardship that protect land from being utilized solely for private gain. And finally, we need resilient solutions. And this is one I'm really passionate about. We can't have our nonprofits in dire financial straits. We can't have them paying their staff what those staff could make at McDonald's and have them be responsible for addressing the homeless crisis. Government needs to stop refusing to pay the true cost of our rehousing programs. We need well-paid, well-trained practitioners who are not working 60 hours a week if we want to see results. And just the last point I'll make before opening it up for questions, although did my last slide, it looks like it might not be there. So I'll just end by saying, I just want to finish on the point that relationships between people we are trying to help and the systems, we want to strengthen that relationship between the people we're trying to help and the systems to help them. Dr. Sean Ginwright wrote a great book called The Four Pivots, where he talks about social movements needing to move from transactional to transformational relationships. Too often, homeless services are transactional. That performative productivity that Deya was talking about, that let me enroll you in this program so I can give you a set of interventions that may have absolutely nothing to do with your needs. And by the way, I don't have time to hear about your needs because I have 20 clients waiting to see me and I have no flexibility in the assistance I can provide. So people talk about people experiencing homelessness being service resistant, but we may actually have a rehousing system that is people resistant. And that is something we've really got to think about, is how to ground this work in the relationships and the real connection that's going to make a difference in people's lives. I will stop there.
Thank you, Molly. I am going to jump right into some questions here. I'm going to skip over my follow-up and just turn my kind of bigger question into a follow-up, mainly for you, Molly. And I encourage anyone watching to submit your own questions to the Q&A. We still have plenty of room for that. I'm going to try to sort of weave some of those questions into my own so we can kind of get a little bit of both. I remember you brought up measure HHH and H, and I remember 5 or 6 years ago when those passed, and these are initiatives that spend billions of dollars on supportive housing and homeless services, and there was a real optimism and sense of hopefulness that we could, quote unquote, solve homelessness or end it, or at least make really significant progress reducing it. But fast forward to the present day, and there are now more people experiencing homelessness than before, and it feels like there's a lot of frustration with that lack of progress. And you explained, Molly, kind of why we haven't made that progress to some extent. But, that political backlash has led to a move toward more support for punitive responses to homelessness that I think we in academia, we in policy world know they don't really work if our goal is reducing homelessness over the long run. Alex M. asked a question about sort of these no camping ordinances that have gotten more common or popular in Los Angeles County over recent years. Also things like busing people to other cities, or proposals to just like ship unhoused people out to like Palmdale or something. I guess my question is, measure H, measure HHH, these initiatives have done a lot of good, and I don't want to dispute that in any way. They're extremely important, but they clearly were not enough on their own, and I'm not confident even that we could pass those same initiatives today, because they did require 2/3 support in this political environment. And so, building on what you shared in your presentation, I'm just curious what lessons you think we can take from the successes as well as the shortcomings of those efforts. Like what more do we need to do in kind of more concrete terms? And Gregg and Deya, to the extent you are familiar with any of this or have anything to say, you're welcome to add on to Molly's response too.
And I would just say, similar to what I said in my presentation, we really need to get honest about the causes of homelessness, and really appreciated Gregg's presentation, because we've got to talk about high rents. Because if we're not addressing high rents, we're going to continue to see incredible numbers of people flooding into homelessness. And one of the things I get frustrated with is sometimes people are like, well, there's nothing happening in LA. We paid all this money and nothing's happening. 19,000 people off the streets is not nothing happening. That's actually a just extraordinary accomplishment The challenge is that inflow into homelessness. And we're going to keep having that inflow into homelessness if we don't address rents. And that is a very tricky, politically divisive conversation. I was involved in passing rent stabilization in the county, and I was shocked at just how strong the opposition is to doing anything about rents. But, you know, the reason I say we've got to use a housing justice framework is we are not, just like we've been saying, we're not going to solve this with programs. That is not the answer. We need to make programs better and we need programs available, but that is not going to stop the inflow. So we've really got to, you know, look at this problem through a whole new lens if we really want to talk about solving it. But Triple H and H are doing a lot of good work, but they're just not strong enough to combat what we're seeing in terms of people not being able to afford rent.
Greg, you skipped over this in your presentation because I know you didn't have a lot of time, but you had a slide on tensions. And I wonder if you could talk about maybe some of those, and maybe specifically the short-term versus long-term tension, because I think that has some bearing on this conversation right now.
Yeah, and I had side conversations with a lot of people at Arrowhead who are policymakers, elected leaders, and staff members, and really the point is being in those roles on the West Coast right now is an incredibly difficult role to play. Because you have an urgent crisis that demands a response, and the electorate demands a response when the best solutions to that crisis are longer term in nature. And so, you know, do we expand shelter capacity and become New York City 2.0 in Seattle or Los Angeles, where 95% plus people are sheltered? Maybe. That doesn't end homelessness. It just recharacterizes it from unsheltered to sheltered. But the other alternative of saying we're going to build supportive housing, we're going to change the housing system, is a longer term solution. And people who are walking around in these downtown areas are not willing to wait 10 or 20 years for a solution. And so it is a damned if you do, damned if you don't situation for elected leaders in these cities. And so it's very, very difficult. And that's what we need. We need political leadership. We need political will. We need resources to say we need to do both of these. We need to have a crisis response system to deal with this immediate need. And we need to have a societal emphasis on ensuring that people can have access to housing through lower rents, through more production of housing, all the above. And that's hard work. To Molly's point, a lot of amazing, well-intentioned, super smart people have been working on this for a long time. If this was an easy fix, we would have taken care of this a long time ago.
Mm-hmm. I mentioned this in the introduction, this idea, well, I'll just get to the question here. I had a friend reach out prior to this event, and he pointed out that in our description for this event, we use the phrase humanely assist those experiencing homelessness. And I don't think that's like a controversial thing to say necessarily, but his point was that it kind of implies that some or many of the actions being taken are inhumane. And that is how I would describe certain actions. But his concern, which is coming from a good place, is that we need a broad base of support. To Greg, your point about the political needs here or demands, we need that broad base of support to pursue the policies that will make a difference in the long run, but that may not show results in the short term. And that base of support is going to be harder to build if people feel like they're being villainized or gaslit or whatever for wanting fairly basic things like clean and passable sidewalks, or so the thinking goes, with this interpretation. This stuff is really difficult to talk about, and I was hesitant to even ask this question, but I think it's an important one because it can come across as putting quality of life concerns, on the same level as the suffering of people living on the streets. But I do think there are a lot of people out there, especially outside academia and the policy establishment, who are frustrated that things seem to be getting worse rather than better, and they feel like they're being told that they have to make this false choice between their own quality of life and humane treatment of people who don't have housing and are dealing with real trauma and suffering. I don't think that everyone who feels that way is a bad person or is a lost cause. And so if that is true, if it is kind of the conditions or circumstances we're putting people in the city in that is leading them to move in that direction, what is it going to take to bring them back in and not kind of push them further away where they feel like we're just villainizing their their opinions, their requests for basic services, that kind of thing. And I can open this up to everyone.
Yeah, I would say that it's also a bit of a false dichotomy. I think that it can be both. And we can expect, or we can ask, those two things are not mutually exclusive. We can ask for, housing for unhoused people in a humane system, and then also think that it's important for folks to care about wanting to have, clean sidewalks and those things. I think that what we need to focus on here is the systemic part of it. So, for example, when we talk about racism, and Bonnie Yasiva talks in his book, Racism Without Racists, you can have a system where not a single person is racist and have racist outcomes. Similarly, in this system, you could have really well-intentioned folks, which we do, working to try and help folks every single day and still not have the outcomes that we want, because the real thing that we need, which is housing, isn't there, right? And so when we say inhumane, it's not that because we think the people that are working or doing this work are wanting to have bad intent or bad outcomes. It's that's the way the system is set up.
Yeah, I just want to second that, because I think, you can argue that even when we're helping people, it's inhumane the way we help them. Yes, some people will be like, oh, sweeps are so inhumane, but there's so many things about the way we structure our approach to homelessness that are not really healing and trauma informed. Unfortunately, we have a system that is still really rooted in a lot of those theories of exclusion. We make it incredibly hard for people to get housing assistance. And even once you get housing assistance, you have to annually recertify, and you have to have your apartment inspected, and you generally have to rent an apartment in a pretty terrible part of the city you live in because our voucher payment standard is so low. So you're living in a neighborhood with a lot of crime and access to bad schools. And the extent of the problems in our system and the lack of humanity is very pervasive. So we have a lot of work to do to really be embracing every member of our community and really wanting to create a meaningful, healthy home for every member in our community.
I had a question here from Jay Ross. It basically is a question about demand. We've talked about supply, essentially, how we don't have enough housing generally, and so rents are high, and we specifically don't have enough subsidized housing, supportive housing. But this is, it is supply and demand, and we have a problem in places with high demand specifically relative to supply. And so the question really is, what can we do on that end? Are there things we can do on that end? And I think, when they're talking about demand, they're really talking about jobs and income. So, one reason housing can be too expensive is because it's just a very high price. Another reason is because incomes are too low. LA is almost unique in the country as having very high housing prices and very low incomes. And so what do we think about the role of that? I know Los Angeles has done things like a $15 minimum wage that has gone up since that time. Clearly that is not enough actually for people to afford housing here. So what else can or should be done on the demand side to help address this problem?
Well, I'll take a crack at this. One of the critiques we make of local policy making in our book is the passion that local elected leaders have on bringing jobs to a community. And we will use many levers of government to ensure that new factories, new jobs, new facilities are constructed in our communities. Yet we do not pay similar attention to where those people are going to live, right? And we just kind of put our heads in the sand and then say, well, the market will figure this out. And we've seen this over and over and over. And so I think there's a really important question for local jurisdictions to say, I'm not opposed to jobs. I think jobs are a very good thing. But if we're going to use the levers of government, use tax rebates to invite employers into a community, there should be an equal, if not greater, conversation about the housing implications of those decisions. And so I'm actually going to Kentucky in a couple months. They're opening up a number of new large solar facilities in Kentucky, and there's great concern about the pressures that that's going to put on the housing market in a state that otherwise has relatively affordable housing. And so we're going to be talking about what's the housing side of that discussion. And so I think that has been missing, not just in Los Angeles, but around the country for a long time, and we're paying a dear price for that right now.
I'll just add in, I think rents are the number one issue. So we can take the approach of trying to produce enough housing with low enough rents. That could be affordable housing, that could be social housing, that could be public housing. I think we're honestly insane in this country to not be producing public housing when we have homelessness, at rates that we do right now. We've got to find a way. The other option is rent control. True rent control is illegal in California because of the Costa-Hawkins Act. But you either have to find a way to cap rents or you have to produce housing, and not market rate housing. It's going to be rent with subsidized rent if you want to get rents low enough for us to address the need.
And also be okay to provide housing to some people who will not be able to pay anything for it.
Yeah. Supportive housing would qualify as that, right? Do you always have to have income to qualify for supportive housing? I know
you can have zero income and be supportive housing.
Okay. Just wanted to confirm that. While we're on the subject of market rate housing, I don't want this to get into a whole discussion about it because it's its own hour-and-a-half long webinar for sure. I can refer folks to an episode we did on the Housing Voice podcast a while back. It's episode 5 with Evan Mast, where we talk about kind of the role that market rate housing has to play. Gregg, really quickly, I wonder if you could just say something about that role, though. And, Marianne Lowenthal has a question about whether, affordable housing and middle market housing really needs to be subsidized, and kind of making the point that yes, it does. But I think there's often this framing of it's, for every market rate housing unit that's built, that's a subsidized unit that wasn't built. And that's not true, but I wonder if you could kind of expand on that a little bit.
Yeah, I don't believe that market rate housing is the solution to the housing and homelessness crisis. I don't believe that. Do I believe that we desperately need more market rate housing? Absolutely. And so that can end up being a difficult conversation, because I certainly am in conversation with people saying all of our efforts should be focused on subsidized housing, and I find it hard to disagree with that. But our region, the Puget Sound region, is estimated to need 700,000 housing units over the next 30 years to accommodate the growth that we expect. A lot of that's going to be market rate housing. You may like that, you may not like that, but that's a necessity. We need to have land use that accommodates sufficient housing production so that we can accommodate all these people who are going to be moving here. And that means we're going to have a denser environment, right? We're going to change our land use. That alone is not sufficient. And therefore, when I think about the levers of government, one lever is to ensure that we can build market rate housing to accommodate growth. And then the other lever of government is the purse strings. And that's where we need to have money to construct social housing, public housing, subsidized housing, vouchers, whatever it is, to ensure that people who have incomes that are lower than the market will withstand, from a housing standpoint, can access housing. And so that to me is the two roles of government. And sometimes we pit those against each other, which I find to be sometimes distracting and maybe not terribly productive. I am firmly in the camp that the government has a major role to play in ensuring that low-income folks can have access to housing.
All right, we only have 5 minutes left here. I want to end on a positive note to the extent possible for a not very positive topic. For each of you, just a minute or so, a minute and a half maybe, what are some places or experiences, case studies that you look to as examples for how to more effectively and compassionately reduce homelessness, whether that's on the prevention side, on services and other forms of assistance, on housing, or all of the above? I'll let you decide who wants to go first here.
I can take the first stab and just say a couple of things. One, I would say, so obviously lots of challenges in LA, but LA is actually a really exciting place to be doing this work right now. Obviously, we have a state of emergency, a big focus on homelessness, incredible political will around the issue, which is making LA pretty inspiring right now. But we're not producing enough housing, so if we really want to think about housing, we do want to think about places that have a right to housing. I think that's fundamental. So there are countries in Europe with a right to housing, but also where that's most effective is where people are producing a lot of housing. And so, a lot of focus on cities like Vienna and Helsinki that are producing lots of subsidized housing, which is, incredibly inspiring, and hopefully we'll get there in LA at some point.
Yeah, I could go next. I think Molly is right that there is a lot of really good and interesting stuff happening in LA, and folks are really trying to use the resources the best that they can with the lack of actual housing to be able to put folks in there. I would also echo thinking about countries that have a more robust public housing system. I think we really need that in the United States in order to be able to make housing a human right for folks and really de-commodify housing. And so I would also like to point out that we do subsidize some housing, market rate housing here in the U.S. for folks who are homeowners. And with the mortgage interest deduction, that makes folks' housing more affordable. And we should be doing that for folks across the board. Yeah.
I do want to just flag that Rita Crabtree-Camp just mentioned in one of the questions the share collaborative housing in Culver City as a sort of transitional / permanent housing option. I just wanted to note that folks have, are talking about these things. I know Sola Impact is an interesting company that's doing some stuff here in Los Angeles County. So kind of to Molly's point, there's so much innovation happening here. Gregg, I will let you have the final word on this.
Great. Well, thank you, Shane, Molly, and Dea. Thanks so much for your thoughts on this. Dea, obviously, all thoughts with you, the Spartan community this week. My area of optimism really comes from questions that I frequently get, which is, Gregg, how do you know that housing's going to end homelessness? And I always say, because we did it with veteran homelessness. We cut veteran homelessness by 50% over a decade. And how did we do that? We gave people, in some cases, housing units, in some cases with supportive services if they needed that, and in other cases it was vouchers. But we were able to do that. And why did we do that? We had the political will and resources dedicated at the federal level to do so. And so the question is not whether this works. We know it works. The question is, will we apply that logic, that investment, and that kind of political oomph to provide a similar response for a broader population of people who didn't serve in the armed forces? And so while that could be viewed as frustrating, it can also be viewed as optimistic in the sense that we don't have to argue about whether housing ends homelessness. Now let's figure out how do we do that. So that's why I wake up optimistic that we'll make progress on this issue.
I think that's a great place to end. Gregg, Dea, Molly, thank you so much for joining us here. Again, we really, really appreciate you. And thanks to all the participants. We'll see you next time.
Bye-bye.
Thank you.